When a patient is brought with transient loss of consciousness, we usually summon the person who was with the patient to explain the sequence of events, and this helps us differentiate an epileptic seizure from a syncope and a non-epileptic pseudo seizure or hysterical conversion reaction. So the first and foremost, how the eyes were during the event. The eyes would be open and having versive eye movements during a seizure, while the eyes would be usually open or at times closed, but if open, it will be upgaze in a true syncope. The eyes would be closed invariably in a pseudo seizures, and forceful opening cannot be done in a non-epileptic seizures. The duration of the event is usually less than 1 to 2 minutes in a true seizure. It is always less than 1 minute in a syncope, while it can be variable and prolonged in a non-convulsive seizures. Injuries are frequent and tongue is the usual culprit. In a true seizures, the tongue bites are usually on the lateral aspect of the tongue, while in a syncope, it is usually at the tip of the tongue, and classically pseudo seizures do not have tongue bites. The distractibility is usually very strong in a non-convulsive seizures, but are almost always absent in a true seizure and a syncope. The motor movements are usually synchronous and rhythmic, involving both upper limb and lower limb in a true seizure, while there are just a few myoclonus in a syncope, and they are almost always non-synchronous in a non-epileptic seizure. Awakening after the event is usually immediate in a syncope, can be variable, and long in a true seizure depending on the duration of seizure, and it's usually variable in a non-convulsive seizures. Then coming to the urination, it's usually present in a true seizure, occasionally can occur in a syncope, but almost never happens in a pseudo seizures. Hyperventilation is usually uncommon in a seizure, but can occur before the event in a syncope, and it's almost many of the time it is present in a non-epileptic seizures. Bilateral convulsions with preserved consciousness almost never occur in a true seizure or a syncope, and it's the hallmark of a true non-epileptic seizure.